World Breast Cancer Awareness Day ama Karkinos Manipur na sinduna haukiba October gi tang 18 da Karkinos Manipur Cancer Care Institute Jenims Campus Porampata pangthokre. Thauram aduda Dr. Sapam Ranjan, Health Minister Government of Manipur na chief guest, Dr. R. Venkataraman, Founder and CEO Karkinos Healthcare Private Limited na President, Sri Biswanath Sinha, Director Policy and Technical Support Water at Indiana, Guest of Honor, Dr. J.S. Moirangthem, Director CEO Karkinos Manipur Unit, Dr. Y. Indibor, Senior Consultant and ISOD Radiation Onco Karkinos Manipur Unit na Special Guest oina dais the Punky. Pangthokiba Thoromadu ki matangda Dr. Y. Indibor, Senior Consultant and ISOD Radiation Onco Karkinos Manipur Unit na asumna phongdoki.
Apagi Prithibi pumbagi malem gi oina breast cancer haidi nupi obisingi thabakta naba cancer se masi khangmin naba mayam punna lantheng manaba fight to minaba adagi masi matam matau karamna akoina ngantana detect to gani khangdokani amadi masibu matau karamna akoina laying duna laina sidagi kanbangam naba haidi how to face and how to detect early and also conquer this dreaded disease. Haidi masigi laina say is the most commonest amongst the female. Breast cancer is a non-communicable disease the number one. Haidi akoigi cancer wherever nupi besingi. Masi Hanadi about say they say 2 to 3 decades back. Sahi kun kunthai mamang the breast cancer suffers only middle-aged and the elderly. Other hojikti age migration means naha to sunareba 20 years 30 years old. Masi kari marum gino ade matokram na khoi ka khangmin raga matokram na masi tingadage dagi early detection tokdana anab sidagi kanbangam gadage haiba masina tim nungi waibo wakhal loiraga Prithibi Malemgi oina international, global as well as national breast cancer awareness month. Adugi damakta koina yamna piklap su pikna layer su laitra su koina angamba kara khaijana dana patient singa loina na media gi through the su koina propagate to ba koina mayam khangmin si adu masi khangmin ra gyan ta minar gadi awareness layer gadi koina nganna detect to ngam gadi ana basi cure to ngam gane haidi treatment si koi last test la agadi treatment singam de ada anabasi am the fatal loeva 1 in every 8 female will have breast cancer. Yeah. It is predicted by this 2030 haidi nupi besingi nipan gi manung da amadi soidana cancer na ra neba its incidence am increase where kari maram gi no what are the factors adu khangmin na bakar leba ko adu chinjak ta gi ra kari da gi no lifestyle de gi ra adu gi su Pandamasida yauri, breast cancer awareness ida. Aduna koina mafam da chatuna media gi through the adagi khabar da adagi TV da koina breast cancer matokram na isana detect togani matokram na ngantana khangani ado kibiganu ya don't hide ya as soon as you have any suspicious lump at the breast lebakanda come to the doctor sinabako we will adugi awareness kadi am phayeba America gumba western country da di they have the breast cancer, but mortality rate is low. Out of say 100, they will 90% will be cured, and only 10 will be very late incurable. Just the opposite in India, according to our state of Manipur also. 90% will come in the late stage incurable. Only 10%, 20% will come in incurable. We want to reverse it, this trend. That's why we are holding this breast cancer awareness month, and we have a long series of activities throughout the month. We have given so many talks and radio, television. We have gone to the community, to the rural area. And also, I would like to request to all the breast cancer survivors and others that spread this message to all your localities and relatives and to the students, also to the schools, that breast cancer should be detected early. It is curable. It is not curable here because we detect very late. This is the main message I would like to give to this gathering. So also enjoy today's free screening and the free service we are giving Karkinos. Karkinos is doing everything thanks to our founder CEO. We are giving it at the community level, right at your doorstep, and also right before the disease starts. When we want, our motto is prevention. Prevention is better than cure. So with this idea and how to prevent breast cancer is, we cannot prevent it. It is a secondary prevention. We detect it early. Yang wan na khang base. Hekta narakadore harga khang base. Sige damakta awareness is the best. The key to success is the awareness. Isada ay breast cancer narakpayay. Ado apom mamala regadi. Doctor da check to gadabni. Ay sahi angang warsu naha warsu. Family history lebiyay leitabiyay. Ado thuna lakpiba losan na thambidaba.
Dr. J.S. Moirangthem, Director, CEO Karkinos Manipur Unit na thorum adugi matangda asumna haiki.
My pusida kathoping bahai for the welfare of the cancer. How to prevent cancer, how to detect cancer early, how to treat cancer early for the benefit of the mankind. This is the first step he has done. He resigned from the prestigious post of managing trustee of Ratan Tata Trust, and he took up this challenge. Started center Koshida Hankre, Delhi da Hankre, Maharashtra da Hankre, Guwahati da Hankre, Mumbai da Hankre, Bhopal da Hankre. So many centers he established. But he chose Manipur. We should be fortunate enough. I told myself, very fortunate enough. R. Venkatraman, he has chosen Manipur. That he came down to meet Honorable Chief Minister Shri N. Biren Singh, that he wanted to start a dedicated cancer hospital in Imphal, in Manipur. Dedicated cancer hospital, just like a Tata Memorial Ma Linkhatingi, Haidana, he has approached Honorable Chief Minister N. Biren Singh, who was very happy. He was very happy. He has readily agreed. Then he put up in the cabinet, of which Dr. Ranjan is one of the cabinet minister. Cabinet approved, and such a prestigious land, 3.2 acre land, has been given to us on a lease. That's how this, this hospital. You are saying, his plan and his project and everything. So I must, thank him from the corner of my heart, and everybody in people of Manipur should owe a lot to him. Please give a big hand about him. He does not like, he will charge me like, because appreciating he does not like. But I am telling in my duty, I don't mention his contribution to the people of Manipur. It's not that he has got money. It's not that my paisa like that. He ran from door to door, investor to investor, company to companies, begging funds. It's not that, he has got huge crores of rupees and stuff, not like that. But his commitment to start the cancer in this remote corner of the country, that highly commendable, highly commendable. I can't resist. I can't resist to tell all these things. So, but we are facing lots of problems. That I own this thing, but for whom? For the people of Manipur, for the neighboring country, for the neighboring state. Someone who was born in Mumbai, Chennai, now in Mumbai, coming down to corner of the country to establish a cancer hospital, dedicated cancer hospital, just like Tata Memorial Dona, whatever available there, he is bringing in. We have got so many challenges, so many problems we are facing. So many equipments are lying stranded in Guwahati, Dimapur for the last 4 months because of frequent drone blockade, because so many people, turmoil in Manipur. Whatever cost, it has become double. Whatever that shipment has to be diverted to Silchar again, come down to Jiribam again. So in all these problems, in spite of all these things, we are coming up and we are capable of doing this. Up to this stage, all of you have seen. Mayam Ubiri 13 December 2021, we have done Bhumi Puja for this building. We were only four. I myself, Rajesh, Imo, and Kamal. We four only were there. 2021, we have done Bhumi Puja. Again, 4th January 2022, our Honorable Prime Minister, Narendra Modi ji, has laid the foundation stone for this hospital of Barswell Mott. On 23rd November 2022, Bhavan Sai Baba's birthday, we have opened that. Our chief said, don't wait. Buildings have a loading. Before you complete building, you start seeing the patient. That's what we have utilized those, those boys' hostel allotted to us by the government, by the General Authority, to see patient, to give chemotherapy to the patient. We have started seeing patients from 23rd November 2002 onward. This is how we have been contributing. At the same time, our motto, he always very particular, is to be accessible, is to be affordable. People patient people what is the point of putting CT scan, PET scan, everything, if patient can afford to come? Patient what is the point of installing big equipment, PET scan, CAT scan, what not? That is their life affordability and accessibility. So his message that nobody should be derived of special onco care in want of accessibility and money. Ashiki my message never.
Siri Biswanath Sinha, Director Police and Technical Support Water at Indiana, World Breast Cancer Awareness Day ki matangda asuna phongdoki.
Akwai oja GS moirang temna haibi gi bado kaino je as much as possible affordable same bai je affordable same yam pai kai gina ID treatment je mapan chalaga kari mate ekta paisa lo bando adu phajana khang de ba moi di mayam ajo list pisal laga si to haibada adu madam ju phat leite kaino to bai phajana khang bagi adugi asijiga local doctors laini local staff laini moina masana phajana ju explain to ngamgani ai ningi adu yung manak te leiraga treatment hon baga mapan te janda treatment to hotel dana da guest house ta leiraga treatment hon baje yam khena bani haiba ei isa ma ki experience ta ei adumaina ningjai kaigina adi yung manak te leiradi isa ki family members leire friend circle leire adu karigumba mathau daraga you can fall on someone else which is nearby adugi any investment for this kind of facility by any person from any company should be welcomed wholeheartedly. I know that minding say. Aduga Karkinos na karigi ay na jampam baje. Moi Karkinos ta yauri meeting je. Isan na zuhan ate kang barina. Sahi tara de he na kange akoy kano siso Dr. R. Venkat Ramanan su. Aduga asiga yauri kano staff jing su. Akoy thabak sunarangi. Ay su Tata Trust lady ay da Manipur da. Yang tu anya langi, Manipur tu awak project tu orang ni. Ado staff ladies in situ yang na apa mamon siang ba dedicated staff ni. Ado ki aina ning bada si yang na bajana o ini ningi ado sige mi kan wajing na support pi di bajana o ini. Ado kaya di ngasai kan na ADS field specialist nete ko. Ado itu as a general public kara kind tum lari kara pa bada ingkang bada ngasai Dr. Indiborn haigi baduga yaugi akwai India dadi unlike US akwai treatment je to bada yam thengdaraga tawba adu last stage ta nataga kind medium stage ta laga detect oi baje adu ge recovery to baje yam wai ai ba aduga detect to de karam kamain oi ni detect can be detect oi baje di test or detect oi gani haiba test or detect oi roi ade ko na advanced stage ta karaga masana rakpadai ade symptoms yam chawrak padai hoi treatment do badai matung da recovery do badai yam wai haiba ꯑꯗꯨꯒꯤ ꯑꯩꯈꯣꯏ ꯁꯔꯚꯦ ꯑꯃꯗ ꯍꯥꯏ ꯏꯟꯗꯤꯌꯥꯗ out of 100 women ꯄꯨꯟꯁꯤꯁꯤꯗ minimum ꯑꯃꯨꯛꯇꯪ ꯑꯣꯏꯔꯁꯨ ꯀꯩꯅꯣ screening ꯇꯧꯕꯁꯦ ꯃꯌꯥꯛ ꯃꯤ ꯀꯌꯥꯅ ꯇꯧꯔꯤ ꯍꯥꯏꯗ 1.6 ꯍꯥꯏꯌꯦ, which is very low. Repeated say khudingi nirate at least one screening in her lifetime haise. In 100 women it is only 1.6. Asin ji helaladi thuna kano detect taw ngamadi akoi aina ningi si phajana kano asibu prevent taw yani.
Karkinos Healthcare Private Limited ki founder and CEO Dr. R. Venkataramananna thorum adugi matangda asumna haiki.
Especially members of the press, I would sincerely urge and request to spread that awareness in a massive way. And also some of the acts or actions, maybe people like yourselves can call out much faster and brighter than clinicians and or people, because for all you know, willpower is much stronger than willpower. And we also see in many of the programs on televisions and others, the extent of surrogate advertising that happens from very established movie stars and cricketers. If you see those ads, obviously oral cancer will increase. We have 45% of global oral cancer burden in the country as compared to any other place in the world, though we are only 7% of the global population. Coming back to specific event and or the cause for today, as Dr. GS and Dr. Indibor have mentioned, if we compare our norms of survival and or management of it as compared to many Western countries, we are probably in an inverted pyramid. But having said that, what is a crisis can be a phenomenal opportunity. And in many ways, provided we are a lot more embracive of many of the public health systems that already exist. And in this case, there are two people or two entities whom we need to show a disproportionate degree of respect and confidence. One is obviously and undoubtedly the doctors and clinicians who have spent their time and lifetime to understand this disease and get to what needs to be done or not done. At the same time, the people as well, as my own founder colleague Dr. Moni Abraham calls it, cancer is everyone's responsibility. The sun, just because it's unhappy tomorrow, doesn't say that, look, I'm not rising tomorrow. So in that sense, the awareness of it should not ideally be restricted to one day alone. And how do we make it like it says all 365 days, spread that awareness to our friends, family, associates, and give them that comfort and confidence that the word see is not like the movie Anand, where when you hear cancer as if one foot is in the grave and it is death. And many of you all present today are a living testimony of that, that not only you can address it holistically, but also live and embrace life with phenomenal degree of dignity, which gives us a lot of confidence to continue to strive to excel with all humility. So thank you once again for the opportunity to be here, and thank you for embracing us wholeheartedly. I cannot but thank the personal support of our Honorable Health Minister, who is available not just to me or my senior colleagues, but every member of our team, irrespective of designation or hierarchy, 24/7. Sir, we need more people like you to support, guide, and counsel us periodically. Your wisdom and insights will help us a long way to make it a live, vibrant, and a sustainable entity.
Chief guest ki warolda Dr. Sapam Ranjal, Health Minister, Government Manipurna asuna phongdokki.
Cancer ki laina sigine haiba kanjada. I think it didn't take long for him to agree to this proposal, to this wonderful proposal. And then I believe the MOU was signed sometime in the month of January 2022. And then construction hore. Duga, I usually Jenims ke kisat pa kansi jai ahamade udaba. Recently, Professor J.S. Moirangtham invited our health department team for a cup of tea. When I saw this building, it was, I mean, the speed at which this building was constructed, it was amazing. And I did go into the round, and I think many of the facilities that are given here yamna aphaba state of the art Manipur gi prajagi kanana baidamakta so that ngasai akhoi gi Mr. Senhana haibi gi bedo Mumbai da chatpa kanda ngari kenu toba kanda Trilok hospital haibi mana main tawridi aduda laiba kanda akhoi gi Manipur gi di ngari eating society ayamana aduda lai haiba gi example ne it is true Trilok hospital to gi example pipi bagi khattani wherever you go Delhi da oiro Vellore da oiro Amma da oiro Guwahati da oiro mayam se Manipur ki patients se yam gre special cancer and akhoi honorable chief minister na Mahatma health pairingai matam do he started on a very innovative project where we call this CM's Health for All, where he felt it was necessary, he felt it was a need of the hour that yumdong kuding chatlaga NCDs, of which breast cancer is also one of them. Kankat naba, thikat naba the CM's All for All, CM's Health for All was initiated, and it is bearing result. Prasagidamukta yumdong kuding chatlaga. Awareness katana tabida diagnose to biraga sigi kenose ngasai nga haibi ke bad maina early detection is the CM's Health for All niam achauba kana ba bi and we are still going on mayam na khangbi do ngasai haibi ke do nupi nipan le bagi manungda ama 2030 bagi manungda breast cancer man nagani haibi do Duga quite common noiba, nupi the cancer, quite common noiba, breast cancer. It's alarming. Mini panda nupi ni panda, ama cancer, lakani ka hebase. It's a prediction. The study the Roma actor ni sigizi yamna. Kiningai ni ki na akoy ito pa diada. Masay gido close the care gap hebase. Akoy ada masay bi giba lump amal laiba kanda. Luga akhoi mahi kai thopa kanda da koi check ta hugudong ne masi ke breast ke lump say I know while I was practicing my friend Dr. Bipin who is here hi boss every time you see a lump in the breast we poke the thing it turns out to be malignant sim hi and it is kari combine to is a lot of study to birang biring what is the cause good habit la genetic la kaino habit and that closing the care gap I bagi meaning result Lady later diagnose cannot over see gap me am Jelena mentioned the beginning of the high baby. Look at NCDs, non-communicable disease, all of us know that late mortality 65% of the cases are because of NCDs, which is also alarming.
Breast cancer ga sagonari ba patient singda asamba khudol poching piduna puming thawatki
Thank you.
Asumna thauram adu mapung phana loisinki